This topic is meter-dosed inhaler. Inhalers are a great option for our patients as they deliver medication straight to the lungs. By delivering medication right to the site of action, we can avoid systemic side effects. With inhalers, you will see medications like short-acting beta agonists like albuterol, long-acting beta agonists like salmeterol, and inhaled corticosteroids such as fluticasone. They're used primarily in the treatment of certain lung conditions like asthma and COPD. There are several types of inhalers, and we're going to talk about meter-dosed inhalers and dry powder inhalers. When educating our patients, it's important that we teach them to first shake the canister well for about 3 to 5 seconds. Then they're going to tilt their head back slightly and exhale slowly. They'll then seal their lips around the mouthpiece and compress on the canister. As they do this, we want to teach them to inhale slowly and hold their breath for about 10 seconds. After the first dose of a meter-dose inhaler, we want to wait about 1 to 2 minutes before we administer additional medications or doses. This is so that first dose can get in the lungs, open up the bronchioles, and the second dose can get in and do the work. As you can see in this image, we want our patients to tilt their head back and exhale. Then we want them to coordinate inhalation with compression of the canister. And as you can see in the third image, we need them to hold their breath for 10 seconds so the medication can get to the lungs right to the site of action. Some patients have trouble with coordinating an inhalation and compression of the canister. And in this case, we can add a spacer. Spacers are especially helpful for patients such as children who lack the coordination to compress and inhale at the same time. This also gives them more time to breathe in the medication. As a result of using a spacer, more medication ends up in the lungs versus staying in the oral cavity. Now let's talk about dry powder inhalers. As you can see here, dry powder inhalers look much different than the inhalers we just talked about. In a dry powder inhaler, the medication is contained in capsules within the inhaler that we have to breathe in powder form versus an aerosolized form like in a meter-dose inhaler. The way we use these and teach patients how to use these is different as well, and it is important that our patients know how to do this as powder feels so much differently than an aerosol, and patients often wonder if they got their dose. To use a dry powder inhaler, we first want to expose the mouthpiece and then prepare the medication inside. This may require dropping a capsule in or turning a switch. Then we want to exhale and seal our lips tightly around the mouthpiece and inhale quickly through the mouth and hold our breath for about 5 to 10 seconds. We want to make sure we inhale quickly and strongly to pull that medication out of the inhaler and down into our lungs. After a dose from a dry powder inhaler, you want to wait about 20 to 30 seconds between inhalations or about 2 to 5 minutes between different types of medications. This image shows a different type of dry powder inhaler. In this type of inhaler, you'd insert a capsule into the inhaler and then administer. It's important that a patient understands exactly how to prepare their medication so they get the right dose.